Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, doctor. Let's start with the basics. What exactly is a seizure and how does it affect the brain?
See, seizure is a medical condition in which your brain is in an excited state, in which your neurons are firing at a higher level. Like if you are in a normal condition, if you want to raise your hand, then it will raise your hand. But if your brain, the particular area of brain is excessively firing, then that leads to the excessive movement of your hand. That is a type of seizure. It can be of a generalized or a focal type of seizure.
What is epilepsy?
Yeah, epilepsy is a medical terminology given when you have more than two or more episodes of seizure, then it is known as, we categorize it as an epilepsy. And it is of various types. Like in it can be, the most common types are generalized epilepsy and there is focal epilepsy. In generalized epilepsy, there is a tonic-clonic type of seizures in which your whole body is convulsing, and in a focal type of seizure, you can see a particular part of your body is under seizure, and the rest of the body is fine, and you are aware of what your body is going through.
Are the different types of seizures and do they affect people differently?
Yeah, the most common types of epilepsy are generalized tonic-clonic type, which we call it as a GTCS. Then another is like focal seizure or partial seizure. Then there are different types also there, like in which your only facial twitching is there. Only there is a type which is known as absence seizure, in which your body is remains still, there is no movement, and the patient will wake up from the same moment where the seizure starts. These are the basically the basic types of seizures which we a general man should know.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Yeah, see, epilepsy, in most of the cases, you will not know the exact cause of epilepsy, but the epilepsy is caused by the excessive activation of your neurons in your brain. But the most common cause is not known, as I say, it is known as essential epilepsy, in which the cause is not known, but there are few causes, like if the patient is having head injury, like the patient is having some CNS infection like meningitis or cerebritis. In those cases, you can get seizures. In cases of fever, also you can get seizures, especially in kids. You can get febrile seizures.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
See, if the patient is having active seizure, the patient is having seizure in which the patient is throwing his body in, which we generally call as fits or mirgi ka dora in layman term. Then the thing is ki the patient will lost his balance, he will fall, the whole body was shaking. Then the first and foremost thing is ki the patient should anyone who is standing beside the patient should keep the patient in lateral position, like he should not be lying straight. The patient should be laterally placed, means the you should rotate the patient so that the saliva of the patient will not go inside the airway of the patient, and the patient might choke, and
Yeah.
there is the patient tongue might fall back and leads to the obstruction of the airway. So we should avoid that. The patient should be all the dangerous items which are beside the patient should be removed, because during the seizures the patient might get hurt himself, and let other people also might get hurt because of that. So these are the basic precautions you should take during epilepsy.
Now let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yeah, it is our unfortunate because it is very unfortunate that in our society the epilepsy is seen as a stigma, but it is a disease like any other disease like diabetes or hypertension. It is a disease in which the patient manifests as these symptoms. So
Yeah.
it should not be looked down upon. But the thing is that there should be an education regarding the epilepsy. The patient with epilepsy usually suffer like he will not get a good job. There will be difficulty in marriage, especially in females. There, if the other person came to know that the patient is having seizure, then there are difficulties in marriage, and even kids also. If the patient having kids, then there is also a stigma that the patient's kid, might also having some epilepsy problems, which is not true in every case. So we should
Oh,
avoid all these, and if the patient is taking proper medication, then there is a epilepsy is most almost always is a treatable disease. There are few cases in which it is not treated with medicine, but in most of the cases, the it is a disease and it can be treated with medications.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
See, the in most of the cases, the epilepsy is because of the hyperactivation of the brain. And it can be because of any stimulus which is hyper, means if there is a strong light is there, that can trigger a seizure, like in marriages on the DJ there is a flickering of light. In discos you can go, there is a flickering of light, fast, dark and very bright lights are there, that can lead to seizures. Loud sound can lead to seizure. If the patient is a known epileptic and patient is taking medication, and if the patient forgot to take his medication, then that can also lead to re seizure, and that is the most common cause of re seizure in a epilepsy patient, forgetting taking medicines. These are very common known factors.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
See, if the patient is a known case of epilepsy, then first of and foremost is the patient should not keep his life and others in danger. Like he should avoid driving during the night time, especially, and if possible, because that is one of the main criteria also during your when you are applying for your driving license. Then one of the column you should take, there is a column there, whether you are a known epileptic or not, you have a history of seizure. It is one of the very main concern, so you should avoid driving as much as possible. It is not key if you are taking regular medication you cannot drive, you can, but you should avoid driving especially during night time. And you should not take part in dangerous sport. You can play normal sports, but you should not take dangerous sports in which there is a if they you have some episode during that activity, then that can lead to the danger to your life and other also. And you can keep your home clean, like the dangerous instruments, like there should not be any sharp corners or to your table and your furniture. And when you are working alone, then you should use your to warm your food, or you for cooking you should not use flame, like you should not your gas or stove. You should use your oven or microwave for heating the instrument, because if there is anything happen to you, then you might lead to the greater catastrophe.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah, as I already told you, the patient of seizure should always take the medication properly as told by his doctor. The medication should not be missed. And if anybody missed one dose, then the patient should take the same dose in the morning. If the patient missed in the evening, then the patient should take double dose in the morning so that the brain is suppressed adequately and the
Yeah.
seizure will not act present. Then
Mhm.
the he should not take part in dangerous sports,
Yeah.
and during night time, there should be a precaution while driving and
Mhm.
traveling. The patient should not go to more or less to the DJ or discos, like where there is a loud sound and loud lights. When the high intensity lights are there,
Mhm.
and all the furniture should be covered adequately. Yeah.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yeah, I would say the epilepsy is a disease. It should be looked as a disease. It is not a stigma. If the patient is taking adequate medication, it is a treatable disease in most of the cases. And if the medicines are not working, then there are few surgeries also in particular cases like brain tumor. And if there are few diseases in which it is treatable with surgery also, then the
Mhm.
patient should not feel ashamed of having epilepsy, and the other people who are surround that patient, the family should not feel ashamed. And it is a
Yeah.
disease, it can happen to anyone. That's it.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.